Hi everyone, Sam is here, Keto Diet Part 4. We've heard that some people who apply the keto diet, they are prone for diabetes. But in reality, we don't have any clinical proof for that type of information. And on the other hand, some diabetes patients, they got cured when they applied the keto diet. How we manage sugar in our body and how we get affected with diabetes. Diabetes is classified into two types, type 1, type 2, which is completely different from each other and they are not related. Type 1 diabetes is related to our genetics. Some people, they are born with bad genetics. It will affect the function of the immune system. In this particular case, the immune system, instead of doing its job by protecting and defending me, it will attack me. The cells which is responsible for producing the hormone insulin, it's called beta cells, which is located in the Langerhans Islands in the pancreas. In that case, when we have a problem with the immune system will attack beta cells and kills it. And that person is not able to produce any more hormone insulin. And he's obliged to take the insulin externally by injection under the skin. Unfortunately, this case has no cure because beta cells is already died. Let's go to type 2. Type 2 diabetes is related to our lifestyle. How we eat, do we do sport or not? Anything we eat is converted into sugar in our blood. When the sugar increases in our bloodstream, that will stimulate the beta cells to produce hormone insulin. The function of the insulin is to transport the sugar from the bloodstream into the cells. As we see in the picture, insulin, it's like a truck. It carries out the sugar from the blood into the cells. But before we reach this step, the insulin should pass through the receptors. The receptors look like a door. When you have a guest coming to you, he knocks on the door, you open the door, the guest comes in. Same process. Insulin carries the sugar from the bloodstream, knocks on the door, the receptor will open, and insulin will deliver the sugar to the cells. Either you store it or you burn it, and life is easy. By eating sugar, we convert part of this sugar into fat. By repeating the same lifestyle daily, and we eat a lot of sugar daily, we accumulate more fat. And sometimes we combine fat and sugar together. And it will start a process of oxidation. The process of oxidation will increase the cholesterol level in your blood. What's the example for this? The sandwich of hamburger. We combine the bun, which is starch, with the burger, which is fat. When you combine two elements together like this, fat and sugar, you start the process of oxidation and you increase your cholesterol level. Another example, when you prepare for a cake, you combine eggs, butter, sugar and flour. Sugar and fat together, it will start this type of process that we mentioned, oxidation, and will increase the cholesterol level in your blood. So by repeating this lifestyle, eating sugar and combine sugar and fat together, you accumulate more fat internally and increase your cholesterol level in your blood. When we eat a lot of sugar and increase our fat accumulation, we build a wall of fat internally. It will be a barrier between the insulin and the cells. And when the sugar increases in the blood, the insulin wants to do its function by transporting the sugar to the cells. When it goes through this way, it will hit the fat wall. The sugar will increase in your blood. Your body will produce more insulin, because sugar is like a poison Your body would like to get rid of it by producing more insulin. Over time, you exhaust the beta cells. You get tired, you get sick, you get aged and older. This process, it's called insulin resistance. Insulin wants to pass through, the fat line will block it. So it's called insulin resistance. You go to your doctor, you complain that you have sugar in your blood. It will give you pills to help you continue in life. In your mind, these pills, it's like medication. But in reality, it's not medication because it doesn't cure you. You take it for life. What's the function of these pills? These pills will stimulate the receptors to open by force to the insulin to be able to pass through. So you're doing something which is not comfortable for your body. You force your body to do something which is not normal. You force the receptors to open by force, and it's covered by fat. This fat, it's like a block. By applying the keto diet, you remove the sugar and starch from your food menu. You benefit two things. Your body will use the fat accumulated in your body as source of energy. It will melt. You will use it and burn it. Number two, you don't combine any more fat and sugar, so you stop the process of oxidation. Your cholesterol level will go down. If you apply this simple recipe by keto diet, by removing the sugar and starch from your food menu, this fat wall will be melted and removed. You will go back again to normal. The insulin hormone will carry the sugar from the blood, transport it into the cells, knock on this receptor will open. You don't need any more this type of pills. You will be a normal person and life will be easy. We eat 3 meals a day, breakfast, lunch, and dinner. The plate of each meal should look like this: 3/4 of the plate from vegetables, 1/4 from fat. At least, you can add more, at least you need to eat 1 pound of vegetables daily. At least 1 pound of vegetables daily, mixed between salad and cooked. And I urge you to buy a steamer, good brand steamer, instead of cooking on the stove. Why? Because when you cook on the stove, you lose 60% of the nutrients. While on the other hand, when you cook on the steamer, you lose only 15%. And also, I urge you to do some sport. It's not necessary to do specific type of sport. The sport that you enjoy and you like to do it. Choose something simple, something you enjoy it. Combination between lifestyle, food, and sport, life will be easy. No medication, no sickness, no complications. This is the end of part 4. I hope you enjoy it. Please subscribe, share it, and send me any comments if you have any question. Wait for me in my next video. I'm going to speak about more complications. People, they complain of keto diet. Thank you for watching. See you.